Hello, moms and dads. Dr. Ty here, and excited to have your sensory and ADHD webinar designed for you if you're a parent at home and your kiddo is struggling with a sensory issue, with an ADHD issue. Maybe you have a formal diagnosis, or maybe it's on your radar and you're not quite sure if you want to pursue getting a formal diagnosis, and more importantly, if you're kind of confused and wondering what can I do to help my kiddo out. And if you're a teacher or a healthcare provider watching this, you're going to get some great information as well. Because ultimately, I want to help you, one, better understand your kiddo's brain, and two, understand what you can do to help their brain feel more calm and more organized. It's something we see a lot of in our office, and that's why I'm excited to share with you today. And you might be wondering, why is a chiropractor talking about this? It's really been a passion of mine personally, and within the realm of neurologically based chiropractic, really what we focus on is the brain and the nervous system. And we find that if we can help the brain feel organized, to feel calm, it helps incredibly with your kiddo with a sensory issue or an ADHD issue. And I'll share some stories as we go along. But the overall picture for today's webinar, we're going to cover a few different things. One is, why is it so important to help your kiddo in order to help your kiddo, why is it important for their brain to feel safe, whether they have one of those diagnoses or not? Why is the brain feeling safe important? We're going to talk about what's going into the brain, and if it's calm going into the brain, guess what? Calm can come out of the brain. One of the things we often overlook as a provider or a parent is that we often see symptoms of a stressed brain or a disorganized brain or a hyperactive brain, right? So we look at what we see in the body. We might see a behavior issue or a meltdown or a tantrum. Maybe we see poor focus, or the teacher reports that your son just doesn't sit still at all, or they're so disorganized they need 6 reminders to get their homework turned in on time. Other symptoms that we might see are a kid avoiding certain situations, maybe avoiding wearing socks or shoes, or avoiding going to areas where there's bright lights or loud noises. And ultimately, it's easy to get caught up on those symptoms in the body, when really what they are is a result of what the brain is telling the body. So if there's stress going into the brain's going to tell the body to be stressed, and you're going to get the list of symptoms that I just described. And then lastly, we're going to talk about how to activate the brake pedal for the nervous system. If you've done much looking into ADHD or sensory, you've most likely run across this nerve here, the vagus nerve. And if you haven't, that's okay too. Ultimately, this is the nerve that helps us calm and regulate, and we're going to talk about why that nerve is important, as well as how to activate it. So I want to jump in with an overall understanding. We're going to talk about this brain feeling safe idea, because the reason it's important is it's the foundation for the nervous system. And when you understand how the nervous system is developing, if you can focus on the foundation, suddenly you can start to get to the higher level things that we want for our kiddo. We want them to be able to engage in the world. We want them to not have to worry about textures of foods. If they only eat chicken nuggets and french fries and pasta, we want them to feel comfortable trying other foods. If you're worried about your kiddo being able to sit still and focus, often there can be an underlying issue of, in all these scenarios, their brain is feeling unsafe. And what do I mean by that? Well, the very bottom of our brain, at the brainstem level, prioritizes safety above all else. If we look at all the other animals, whether it's a reptile like a lizard, or a frog like an amphibian, fish and mammals and everything, their priority number one is always safety. If they're living in the wilderness, they're maybe afraid of being eaten, or they're afraid of finding enough food. So survival and safety is always priority number one. And we get information into our brain to help us feel safe from everything in our surroundings. What happens is if our surroundings are coming into our brain through our five senses, and then we're going to talk about two other senses here that have a big input, both with sensory and with ADHD. If that information is coming in and telling our brain we're okay, it allows our brain to check mark the box of safety. Once it check marks the box of safety, it can move on to the next step. So if it's your kiddo sitting still and paying attention in class, they can say, yep, I check marked the box of safety. Now I can focus on learning how to do addition or subtraction or multiplication. If they check mark the box of safety, they can say, yep, I feel comfortable going into a new environment. I feel comfortable going to a friend's house for a birthday party, even if I've never been there before, because I'm not anticipating this fear that might come with it. What the challenge is if your kiddo has a sensory issue, often the information that's coming into their brain is making their brain feel scared or worried, and they're unable to check mark that box of safety. So to give you an example, if sound is coming into your kid's brain in too loud of a fashion, it's going to make their brain feel worried. Imagine if you're sitting there and you're about to doze off to sleep, maybe you're in your living room chair at home, and your kid comes up with a bullhorn and goes, "Mom!" and yells it in your ear. You jump awake because a whole bunch of sensory sound input just went into your brain and triggered your fight-flight response, which immediately your brain says, "What's going on?" And you jump out of your chair. You realize, oh, okay, it's just the bullhorn my son yelled in my ear. Ultimately, though, if sound is coming in too noisy, it's going to create your brain feeling stressed. And when we have sensory issues, often what's happening is while your brain might be able to handle that environment just fine, your kiddo's brain with a sensory issue feels stressed in that exact same situation. Sight can be another one, and these are often linked together. If bright lights cause your child to be stressed, maybe you put these two together and they never want to go to a movie because you're getting loud sounds and lots of stimulating light. There's sometimes we'll see smell. It's probably not the most common worry in a parent with a sensory issue, but certain smells might throw your child off. Taste might be one where I mentioned before, maybe your kiddo just needs certain really smooth textures and something crunchy or something slimy. Something that we might get by okay triggers stress in your kiddo's brain. Touch, again, is a super common one in the sensory realm. We see a lot of kids who need the seam on their sock lined up just perfect. If it's not perfect, it actually sends stress into their brain, and their brain gets so distracted and worried about that seam on their sock. Again, they can't check the checkbox for safety, and it creates this stress in their body that they're not going to want to worry about making a new friend or paying attention in class. And then the last two senses here that are very important for creating safety in the brain are ones that are often heard of if you've explored OT with your child, or if you've, again, looked more into ways to help. One is called proprioception. It comes from all the little joints and the little muscles. This is a picture of an arm with a muscle, and it allows us to know where we're at in space. So if I step on one foot, my brain sends a whole bunch of proprioception up that foot through that leg to tell my brain, oh, I better fire my muscles differently than if I'm on my other foot. So proprioception allows our brain to know where the body is at. It's why we don't just run into walls all the time. It's why, as a kid, when they're first growing, they maybe don't know how long their arm is, so they're at the kitchen table and they tend to reach too aggressively and spill a cup of water a lot easier than us as an adult. If the brain doesn't know where the body's at, it doesn't feel safe. So it starts to create a stress and panic. It's almost like we saw one little girl who, if she didn't know where her mom was at when they were out in a store, all of a sudden her breathing would tighten and she couldn't breathe because her brain panicked. She didn't know where her mom was at. So same thing for your kiddo. If your child's brain doesn't know where their body's at, it causes that same type of stress. And then the other one, the vestibular, it comes from the inner ears. And it's the sense that allows us to know if we're moving or not. If that's off, you might find your kiddo getting car sick. If it's off, they might hate going on rides at the amusement park. Or on the flip side, sometimes with sensory issues, it's not getting enough information. So your kiddo might crave lots of vestibular input and they love spinning. They love going on the rides because it actually gives them, their brain, this information that they've been missing out on. And it's something that all these senses are constantly being grown over the years. My son right now, he's just over 2 years old, and he loves the vestibular. When we go to the park right now, he's loving going on a swing. There's this little stool you can sit on, and it spins you in circles, and I go a few times around, and I'm pretty dizzy quickly, versus my son will go, because right now he's integrating that system. He's building those connections into his brain by getting that good movement into the brain. What I'll show you here, and I'm just going to put this up close for a reference that you can look at one point. But ultimately what this is a pyramid of development. And at the very top, you'll see learning, you'll see behavior, activities of daily living. Maybe if your kiddo struggles with speech, language skills, all these higher level things are at the top of the pyramid. What we see at the bottom of the pyramid are the things that I just talked about: vestibular, proprioception, and then the other senses. So basically from this dark line down, those are all the senses that I just described here. So you can see in this pyramid, those senses are the foundation for everything else in the brain to build up on top of. The reason they're so foundational is because when they are doing a good job and the brain's able to understand them well, they help the brain feel safe. As I said, if this is good and the brain can check off safety, now it can start to progress into these higher levels. Often those higher levels, like learning, sitting still, like I said, maybe you notice a speech delay with your kiddo. These tend to be the symptoms that concern us as a parent or a provider practitioner, but we're always backing up into the foundational levels of the integrating that sensory piece. So if your kiddo has a sensory diagnosis, it's easy to understand this. However, what about if your kiddo has an ADHD diagnosis? Often there's a sensory component as well. So to give you an example, a young boy in elementary school, say 4th, 5th grade, started seeing us before the beginning of the school year. He had an ADHD diagnosis, but mom said he wasn't really that hyper. He just has a tough time focusing in class. And as I started talking with him, he said the biggest challenge for him is lots of noises. When he's around lots of different sounds, his brain is easily distracted. What we discovered as we were going through things is that noise, the sound, was coming too loudly into his brain, and his brain wasn't able to filter out which one to pay attention to. Instead of his brain saying, I want to pay attention to the teacher, it was letting his classmates' sounds come in if they were tapping a pencil. If there was noise outside in the playground or someone mowing the lawn outside, that information was also coming into his brain, and his brain didn't know which one to pay attention to. So in the realm of the brain spends a lot of energy actually filtering things out. If you picture all these senses are constantly going into the brain, the brain has to decide which is the most important. And if your brain can't spend the energy filtering that out, all of it comes into the brain, and it causes the brain to be very confused. So we get a brain that starts to look disorganized, and not able to calm down and focus in. So as we started adjusting this boy, one thing we worked on was letting his auditory processing, his sound information, come in a more organized way. We started freeing up some resources for his brain to filter out what it didn't need. And this school year so far has been going much better. One of his biggest challenges were math and reading. And mom just reported recently he got an A+ on his math test, and he's actually enjoying reading this school year because we've allowed his brain to start to become more organized instead. So ultimately, we want to make sure that information is coming in, not too loud, not too quiet, but in an organized way. And so if it's coming in organized, that's going to help your child with ADHD as well. I'll give an example later on too, especially in these scenarios that can have a big impact in the ADHD realm. So on to the next piece then, is if you notice your child is distracted, if you notice they're worried, if you notice their brain feeling stressed, I know for myself as a parent, one of the first things I would do is I look at the environment. I say, oh, was he just around someone that was new to him? Maybe he was worried about that. Maybe he ate a food he wasn't used to and that stressed his body out. And after a while, if you can't figure out what's stressing their brain out, it can become exhausting. And especially as a parent, you might find yourself realizing like, okay, we're going to eliminate these dyes, we're going to eliminate gluten, we're going to eliminate dairy and sugar, and we're going to make sure this morning routine goes perfect so he can get dressed and get out to school in the morning. Or maybe you have your nighttime routine for your daughter that has to be everything checked off perfectly, and you spend lots of energy making sure all this stress is staying at bay, and you're keeping it at bay, and you're saying, all right, as long as I do all these things, my child can get through the day okay. But what happens if one little thing starts to crack open? It almost feels like the floodgates open, and you said, oh, box number 3 didn't get checked in the morning routine, tantrum meltdown, here we come, right? And that's exhausting as a parent if you feel like you're walking around on eggshells all the time. So what we help parents look at in our office is less about the environment. My wife is a certified parent coach, and she is really good at helping assess the environment and taking an outside approach to helping families and helping kiddos. What we're experts at in our office is looking at the internal environment. So we realize that there can be stress from the outside, but there can also be stress coming from inside the body. Particularly, we're going to jump here to this proprioceptive stress. What happens is if the brain is getting good proprioception, it goes into the brain and it tells the body to be calm. This input is very calming for the brain. Think about the last time you were really stressed and maybe your spouse came up and gave you a big hug. Maybe you have a weighted blanket at home that you've used yourself or you've used for your child. A weighted blanket is stimulating this sense, and one of the reasons it helps is because that pressure activates this proprioception in the body and it tells the brain it can be calm. Now what happens on the opposite side is if proprioception isn't happening, the brain starts to receive this worry in the body. It's like, oh, I gotta do something. And it starts to actually receive this stress signal from inside the body. The fancy term is nociception. Not necessarily that you need to know that, but ultimately what you do need to know is if something's off, that's stressing off from a proprioceptive sense, if those joints and muscles aren't getting good info to the brain starts to receive stress signals from inside the body. What we see most often in our office is something's off in the upper neck. The reason this is that proprioception comes from all the little muscles and little joints. So there's a lot in the wrists, there's a lot in the ankles. You might have been told by your therapist, your OT, to squeeze their wrists or ankles if they're feeling stressed. And that helps send some prop into the brain, helps calm the brain. Well, because it comes from the little joints and little muscles, where do you think the body has the most of those? As you can guess by a chiropractor giving this talk, it's along the spine. You have little joint, little muscle, little joint, little muscle going do, 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 all the way down the spine. About 60% of the proprioception that goes into the brain comes from the spine. I mentioned the upper neck. About a third of it comes from the upper neck alone. What that means is if something is off just a little bit, it starts to send stress into the brain instead of calm into the brain. Most often we'll see this after labor and delivery. Even in a routine, normal labor and delivery, there's 60 to 90 pounds of pressure as babies being pushed out of the birth canal. Now, if you add, like myself, when I was born, there were forceps involved. Maybe you add suction. Maybe there's a labor where things are stalled for a while or didn't progress as expected. We had one mom whose baby's head, instead of coming through, was stuck in the pelvis, in her pelvis. So each contraction, what that meant was more strain on baby's head. And he actually then, after not being able to be born vaginally, had to be born C-section to come out. And we've checked babies even after pretty smooth, pretty routine births, and even they often have slight misalignments. There was a MD out of Germany that once studied over 1,000 babies, and he found that 80% had something off in their upper neck after initial labor and delivery, after being born. So what happens now is if something is off there, instead of getting calm into the brain right off the bat, the baby starts to receive stress into the brain. And if it doesn't get corrected, that tends to be an internal stress going into the brain that's coming from inside the body. So that's an example of a stress that you might have the outside environment walled off. You might say, all right, we're protecting things really, really well. But what if something's off inside your child's brain that's sending stress into the brain and you don't even know about it? It makes it feel like you're pushing a peanut up a hill with your nose, and it takes a really long time to make progress. So finding stress from inside the body and clearing that out, we use safe, gentle neurological chiropractic, line things up, allow the body to get natural proprioception, natural calm into the brain from inside the body, starts to create tremendous change in the body. There was one little boy that we saw who he had real extreme ADHD and about 5 years old, and we were adjusting him for several months, and all of a sudden he goes to mom one day, he goes, Mom, it used to feel like my brain was always wiggling, like it was always going. Now it feels calm. And the cool thing with him is not only did we start to get some calm into his brain because of this sense, Mom noticed he started eating a lot more. He wasn't nearly as picky of an eater. And because of all this input into the brain helps regulate calm, when the body's calmer, and we'll talk about this in a moment here with the vagus nerve, digestion is another big improvement. So this little boy had to always drink pear juice or prune juice in order to not be constipated. And when we started adjusting him, all of a sudden Mom was able to eliminate those juices and he still had regular bowel movements. So when we impact the nervous system, we're impacting the brain and the body. All right, next piece here then is how about once we have calm going into the brain, what's the other big missing piece for a child's brain who feels like it's always stressed? And that piece is often the ability to access the brake pedal on what's known as the vagus nerve. So the vagus nerve is like when you're driving your car and you hit the gas pedal because you want to take off, and you see a stop sign in the distance or a stoplight, and you say, oh, better start slowing down. You put your foot on the brake and you slow back down. In order to drive your car, you need the gas and you need the brake. Same for our bodies. If you're doing a workout, if you're going for a walk with friends, you need some gas pedal to get the momentum going. If you're sleeping at night, you need the brake pedal to calm things back down. If we actually just an hour ago had our team meeting, and near the end of our team meeting, all of a sudden all our cell phones went, and there was an emergency alert because up in Roseville there was apparently a homicide suspect that was on the loose. And it was kind of like an Amber Alert if a child's missing, except this was an emergency alert saying that just a heads up, someone's on the loose. And then a little bit later, the alarm goes off again. We all jump, and it says the suspect has been apprehended. Whew, and we all calm back down. So the point of that is we need our gas pedal in situations that we need to potentially ramp up our body's resources, because we have this fight-flight response that is designed to help protect us. It's designed to help us fight or flight, run away. It brings all the energy, all the blood flow out to our muscles. It brings the adrenaline. Our heart starts pumping. Our body releases a bunch of blood sugar and cortisol and stress hormones into our bloodstream to give us the ability to take action. So it's a perfectly normal response. What becomes abnormal is if that response gets stuck on. Because if it gets stuck on, it leads to things like chronic inflammation. It leads to a weak immune system, poor digestion. Our body, when it's in fight-flight mode, isn't worried about having a good bowel movement. It isn't worried about fighting off the bugs. It's worried about survival in that moment. And it leads to a rise in blood pressure. It leads to our blood sugar being elevated, and things like cholesterol and the triglycerides in our bloodstream. Those markers tend to all be elevated when we're under chronic stress, and it creates chronic inflammation because the body is saying, hey, you might get injured because if you're fighting a tiger, they might scratch you or cut you, so we need that inflammation ready to create the inflammatory response to heal. So all those things are good short term, but not good long term when they're stuck on. So why do they get stuck on? Either one, because the body is under chronic stress, or two, because the body is unable to come down from it. And that's where the vagus nerve comes into play. So when we're having our team meeting, if our vagus nerve isn't working, what happens is the alarm goes off, and we look and we say, oh, it's to notice that he was in custody. It's safe to go outside again, right? And what should happen is our vagus nerve comes into play, hits the brake pedal and says, okay, you're good to go. Don't worry about it. We take a deep breath. We let it down. We lean back. Our shoulders relax. Our neck muscles relax. Our head, everything relaxes. Our heart slows down, and we leave that fight-flight response. However, if your child's body can't activate that vagus nerve, they go through that exact same situation. Oh, apprehended, we should be okay. But they stay elevated. They stay breathing high. Their heart stays racing, and their brain stays scattered. Because when that is elevated, our brain is saying there's potential danger. It can't checkmark the box of safety, so now it wants to stay in this active, worried mode. So guess what happens to focus or attention? Well, it's not going to be there, right? Because if your brain is worried about a suspect victim or a suspect coming in, if it's worried about a tiger, what does it want to do? It wants to be scanning. It wants to be looking, searching. Where is that invader coming from? And even though your teacher might say, hey, Johnny, pay attention, his brain is saying, sorry, math is on the back burner because I'm worried about surviving. So when your child can't access the vagus nerve, it's really, really tough to focus and pay attention. If sensory stimulation comes in that heightens your child, it's really tough to calm them back down. So the vagus nerve, I'll show you a picture here, comes from the brainstem. They even have something that you may have heard of called vagal nerve stimulation. It's what they do. It's almost like a pacemaker that instead of putting in your heart, they put around your brainstem, and it starts to stimulate the vagus nerve. It's like giving it a little bit of a tap on a regular basis. And they've used it to treat things like depression, ADHD, anxiety, autism, things where the brain stays in this heightened stressed state. So they realize now that it's incredibly important to have the vagus nerve doing its job. Going down, as I mentioned, it controls the heart, it goes into the lungs, it goes into the stomach, and it goes into the intestine. So incredibly important for digestion. That's why you might notice your kid also deals with constipation, like I mentioned before. You might notice your kiddo getting sick a lot. We have a little boy that just started, 5 years old, and mom said every time he's a little tired, he gets a fever. His brain, his body, his brain, his nervous system are in this constant little bit of a stress state, so his immune system can never clear things out. We've adjusted him just a few times, and mom sent us an email yesterday saying, hey, he tried broccoli for the first time. So his nervous system's starting to feel safe, and as it's starting to feel safe, it's now saying it's open to new sensory experiences. In this case, this little orange tongue here, new tastes, and from a tactile perspective, new textures. So, and I'm gonna check my notes here and make sure I'm covering everything we want to cover. What then, where does the vagus nerve get impacted by the spine? So I want to talk about what can throw the vagus nerve off internally. If it's coming, as you see here, coming from that upper neck, if that's where it originates, what can throw it off? And then how can you activate it for calm? Aside from the chiropractic adjustments that we do in our office, I'll cover some things you can do with your kiddo at home to help activate that vagus nerve, because activating vagus nerve activates the brain tunnel. So this was a 7-year-old girl that came to see us, and we do these scans in our office. It's measuring all the different nerve channels that come from the spine. If an area is working well, we see white. If it's off, we'll see mild is green, blue is moderate, and red is severe. So you can see here, obviously, huge amount of stress in her upper neck, which just happens to be the vagus nerve area. Anything in the upper neck, because that's where the vagus nerve originates from, is going to have the biggest impact on that nerve. This little girl, one of the biggest challenges mom had was clothes. So she wouldn't wear socks. She'd wear shoes and like shirts, pants, other articles of clothes that were only one size bigger than what she needed. And like her hands would get really raw in the winter because she wouldn't want to put lotion on. Now, we started adjusting her. Immediately, she started feeling calmer. With that, her body said, I'm feeling safer. Maybe I'll try socks. So within the first couple weeks, all of a sudden I'm adjusting her, and I look down at her feet and say, hey, you're wearing socks today. What's going on? She said, Mom, I tried them on. I actually slept with them last night. They're feeling okay. And then within the first couple months, mom's reporting, not only is she like wearing socks, she's starting to wear different shoes that fit, she's wearing clothes that are the right size. And what mom noticed is that she wasn't fighting anymore to get dressed, which was huge, because you probably know if it takes an hour to get your kiddo out the door in the morning because they're resisting simply getting dressed, if that routine isn't going perfect, it's exhausting as a parent. So mom noticed getting dressed and just a lot easier to get out the door, and clothes that used to feel icky, suddenly she's wearing normally. So how did this happen? Well, you can see the follow-up scan here. Going from scan 1 to scan 2. Still some work to do as her body's working through some older layers, but that huge chunk in that neck is clearing out. Still a little bit there, but way better than what we had initially. And that scan is about 6-7 weeks apart. So in a 7-year-old's life who's been dealing with sensory issues for years, to be able to make that gain in under 2 months is a really big deal for her and a really big deal for her parents and her family. Because we were able to activate the vagus nerve, it allowed a lot more calm to go into the brain. activate the vagus nerve allowed the brake pedal to be accessed, and then clearing out that stress in the upper neck allowed better proprioception to go into the brain, which allowed her brain to receive more calm on a regular basis. So she wasn't getting all that stress from inside her body. She was starting to get calm and organization from inside her body, and she could access the brake pedal when she needed it. Here's another young boy, actually also 7 years old, and you can see his initial scans. A lot going on in that upper neck. Not only are they red, but it's twisted, so it means there's the most amount of strain you can have in that area. When he was young, he had a lot of ear infections. He had some swollen tonsils, adenoids, so he didn't sleep well, and he was getting sick a lot. And I'm just referencing the notes here that parents had shared. He didn't sleep well at night because if he couldn't access his brake pedal, it's really tough to tell the brain to wind down at the end of the day. When he started the school year, he was diagnosed with extreme ADHD. The teacher said he can sit still for about 20 seconds and then he's just off and running. He would have a form that they would have by their desk, and they would want the teacher would want the kiddos to fill out things during the day, like, did you stand in line? Did you put your books away? Did you put your shoes away? And different things that helped make the classroom easier for the teacher to manage all the kids. Normally at the end of the day, he'd have like 1 or 2 boxes out of this whole list checked. So we started adjusting him, and as we focused on clearing out, especially this upper layer, one of the first things parents noticed is he started sleeping better. We're accessing that brake pedal so the brain could calm down for sleep. He started digesting better, and he started breathing better. As he was going through care, parents said, like, hey, he's not getting sick nearly as often. But the biggest thing was what school reported. After a bit, and again here referencing, so again, this is about a 2-month period. So significant change, which is cool about what we do, is often you can see changes really quickly rather than a year of certain therapy, let's say, before you start to notice change. The form that he started filling out at school, he's coming home suddenly with it 80-90% filled out instead of just a little bit. And after a few months into that school year, he got retested, and he was now, instead of extreme ADHD, he dropped all the way down. The test is like, well, he's like barely qualifying for ADHD. You know, if you were to drop a little bit more, that label would be pulled altogether. So really huge change, and you can see his follow-up scan here, way better than when we started. That twist is clearing out, so now he's getting more calm from his body into his brain, and he's getting access to that vagus nerve. So what can you do at home? Let's say you are under chiropractic care, you know your kiddos, especially that upper neck, is lined up and it's doing well. Or maybe you're saying like, yeah, I know chiropractic's on my list to get checked, but I'm not sure when I'm going to be able to get in. What can you do to access your kiddo's vagus nerve at home? So I want to share a few different things that you can do to keep in mind for jogging your own memory around it. Vagus nerve goes down, goes through the throat. It helps a lot of sensory input from the mouth and down the throat. As we talked about, some kids with picky eating, when they get adjusted, they're open to more foods. So it has a lot to do too with syncing the facial expressions and words with what you're hearing. So the reason I share all that are some things you can do to stimulate the vagus nerve have to do with activating this area. So singing, humming, chanting, anything that go you don't necessarily need to vibrate that area. I'm just doing it so you can hear. Vibrate and stimulate and that vocal cord area. Gargling water is going to stimulate that area. Breathing is really important. Obviously, taking a deep breath helps activate the lungs, which are innervated by the vagus nerve. But there's a specific breath I'll share with you here called straw breathing. So like you're going to suck through a straw, except it has to do with how you're breathing out. So if you take a big breath in, breathe out like you're holding a straw, like you're breathing through a straw. Breathe out about 80%. And then the last 20%, shut your lips and breathe out through your nose. And you try to push your air 100% out and let it come in naturally. So you take a breath, breathe out, 80% of the way gone through your, once that's 80% through your imaginary straw, breathe the last 20% through your nose. And then once you can't push any more out, breathe in. After you do that, breathe a couple normal breaths and then repeat that 2 to 3 times. What that does is activates the vagus nerve because you're really working on the diaphragm. You're working on some of the muscles, as I mentioned, through this area, getting everything pushed out and expanding with a nice breath in. Along the lines of breathing, anything that causes you to breathe more, like going for a walk, exercising, playing on the playground, doing martial arts, doing dance, doing gymnastics, ballet, all those things help stimulate the vagus nerve. I mentioned before, maybe your kiddo likes to spin, likes to crave that input. So if you find that they have almost, some kids might have what's called a stim, where they do something with their hands, or they do something that seems very repetitive. Often they're craving input into the brain, and usually that input that they're craving is because it's activating the vagus nerve. So while it's something that eventually you might want to see go away in your kiddo because it's telling you your kiddo's brain isn't craving that input all the time, in the moment it's soothing and calming for the brain. So it's something their brain is craving, and you don't necessarily want to say like, hey, stop doing that, stop spinning. You want to say, okay, well, let them do that in the moment because it's helping give good calm into their brain. It's helping activate the vagus nerve. But let's address why their body's craving it so much to begin with. Socializing is another thing that activates the vagus nerve. Our brain has a lot of neurons fired for social engagement. And one of the things the vagus nerve does is it's looking at facial expressions and trying to match it up with the words that it's hearing. So if someone's face says, hey, there's a prisoner outside, it's really dangerous outside, you should run away, and yet they're smiling the whole time, the vagus nerve is kind of sitting back and wondering, that doesn't seem right. They look really happy, but the words they're telling me imply that there's danger. Something's off. So the vagus nerve is always practicing. What is it hearing versus what is it seeing? And when it can see someone's facial expressions, it gets more practice. And so that's why social interaction is not only important for the brain overall, but for the vagus nerve development, especially when it's with someone that your kiddo feels safe with. Because, right, we always want to check that box of safety. If it's someone that they don't feel safe with, they're going to be on edge that whole time, and it's not going to allow their nervous system to let down. So finding someone that they feel safe and comfortable with and having social interaction is really good for the vagus nerve. Of course, as I said, seeing if their body is in trouble, if there is a stress internally, that's stressing them out is going to be what I find gets you the biggest bang for your buck. There was a woman I was adjusting once, and I was adjusting right up top here in her neck, which is one of the key areas for the vagus nerve. It's the C1 area. And as I was adjusting that area, she looks at me and she goes, hey, that's where my therapist told me to massage to stimulate my vagus nerve. And what we had a discussion around then is if that area isn't working normally, it takes a lot of self-massage, it takes a lot of meditating and deep breathing to remind your body, yep, the vagus nerve is there, the brake pedal's there, the brake pedal's there, here's how to use it, yep, I'm going to stimulate it, I'm going to stimulate it, I'm going to stimulate it to keep it going. But what about if that interference was removed and the body could just stimulate the vagus nerve naturally the way it's designed to? Right? When you're driving your car, when you see a stoplight, you should just be able to push your foot on the brake and have it slow down. But what if the um, the brake fluid that allows us to have like really easy braking, what if that was taken away? I never have had to drive one of these cars, but I picture in the way old school cars, my grandparents, my parents telling stories are like, you had to like stomp on the brake to get it to stop sometimes. Well, imagine if your child's brain was working so hard that the only way it could access the brake pedal is if it took like 5 people pushing as hard as they could on the brake to get it to go. Well, guess what? They're not going to want to engage the brake pedal very often. They're not going to want to go very fast or very far because they say, no, that's too much work to try to hit the brake pedal. Or they're going to be lying in bed at night tossing and turning because they can't get that brake pedal accessed without a whole bunch of outside stimulation. So what we want to do is empower your kiddo to access that naturally. And that's where we look for stresses interfering with that, clearing those stresses out, and now guess what? They can hit the brake pedal a lot easier and allow their whole sensory system to become more regulated. Allow their brain to go from that stressed out mode into a more calm and more peaceful mode. And it doesn't mean that all of a sudden we flip a switch and everything goes away and your kiddo's perfect for the rest of their life. But what it does mean is that their resiliency and their adaptability grows and grows and grows. They start to learn how to access their own inner healer, their own personal power, because they know that those tools are available to them through their nervous system, healthy and functioning the way it should be. So if you haven't been to a chiropractor, I strongly recommend looking into someone with a neurological approach, looking into someone who does those scans. If you're in the Twin Cities, we'd love to see you. If you're outside the Twin Cities, shoot us a message. We'll find someone in your area who works with kids with sensory and ADHD issues. If you are here and would like to get an eval and you've never had that done before, we're happy to do that in our office. Currently, it's $150, which is pretty reasonable. If you've watched this webinar and you mention this when you schedule an appointment, we'll take half off of that. We'll drop it down to $75. The reason we do that, one, is to incentivize you to get your kiddo checked, because I don't want your kiddo to go another year, another 2 years, another 3 years dealing with these challenges when it could be an internal fix that's a lot potentially simpler than you realize. And because you've just took the time to watch this webinar, it saves us a lot of time in the office, so we can afford to give you that savings. So please reach out if you'd like an appointment. Please reach out if you have any questions, and know that your kiddo's brain is pretty amazing. We see sometimes kiddos with these ADHD brains, it's like a super brain. They just need to know how to access the brake pedal a little better to be able to focus that super brain in and be able to still shift gears really quickly, but also focus in when needed. And if your kiddo has a sensory issue, we love helping their brain feel calmer and more organized and really getting to the other side of it so they can start to open up and engage in the world instead of being shut down and protected. So I will talk to you soon.